So here we are starting with our first topic, H. pylori, which is the PYT of this year INICET exam 2025. So here we will mainly discuss about what's repeatedly tested and likely hot for the coming exams. So first is the morphology. It is a gram-negative, curved and spiral rod, darting motility and strongly urease positive, and that is the reason behind its survival in the gastric acid. Now the virulence and the pathogenesis. CAG-A is responsible for its increased risk of the gastric carcinoma, and that is intestinal type, and BAC-A is vacuolating cytotoxin, that is responsible for the epithelial injury. Adhesions, BABA is responsible for its adherence to the gastric epithelium. Now the clinical associations. This duodenal ulcer is more strongly linked, and gastric ulcer is less frequently linked with this. Marked lymphoma, we have to remember that it regresses after the antibiotics, and the gastric adenocarcinoma is due to this CAG-A strains. Now the diagnostics used for this disease is peptic ulcer disease, mainly it cause. So that is rapid urease test, rapid urease test, that is CLO test, where we do biopsy and we tested it with urea, and there is this color change, pink color, you see. And urea breath test, that is C1314. It is non-invasive. First thing, it is non-invasive, and it is used for the diagnosis as well as test of cure. Like after completing the antibiotics, we do this test of cure to know if there is eradication or not. And stool antigen test, again it is a non-invasive, used for eradication check. Histology mein the stain which we use is Wharton starry silver stain. Now the treatment according to the current guidelines, it is 14-day bismuth based quadruple therapy is the preferred empiric first line, which includes PPIs, bismuth, tetracycline and metronidazole. So earlier we were giving this clarithromycin triple therapy. This is only given if the susceptibility is known. And what is this test of cure? So this is, in this we use this UBT. We do this UBT, that is urea breath test or stool antigen, that is done after completing the course after 4 weeks after antibiotics. After completing antibiotics, 4 weeks after that, and they should be also patient should stop with PPIs 2 weeks before this test. So now according to this ACG 2024 recommends this BQT, that is bismuth based quadruple therapy, as a preferred first line empiric treatment regimen. So this we know, and earlier it was amoxi and clarithromycin, and they are part of the older triple regimens, not this current. And one thing we have to remember, that this ACG advises against use of this clarithromycin based triple therapy unless antibiotic susceptibility is confirmed, and if eradication failed, like after giving the antibiotics, you go for this test of cure, and again there is positive test, will switch to a different regimen, and it is usually bismuth quadruple or a salvage regimen, that means not the same antibiotics again. Now first thing, empiric treatment we have studied. Now amoxiclarithrol we have to just remember that it is outdated, and now we have different regimens and status and when used. Bismuth based quadruple therapy, preferred empiric first line for 14 days. Clarithromycin based triple therapy, which includes PPI, clarithromycin, amoxi, only it is given only if the antibiotic susceptibility is confirmed or resistance or region has the low resistance. And now the non-bismuth quadruple, this includes PPI, amoxi, clarithromycin plus metronidazole. It is alternative and useful in areas with moderate resistance. And this rifabutin based, vanoprazan is a new PPI. So you can tell me this, what is this vanoprazone if you want. Okay, so this is a PPI plus PCAB plus amoxi plus minus clarithromycin or rifabutin we are using. These are the suggested alternatives when BQT cannot be used or as a salvage regimen. So this we know, and now the buzzwords, just go through this. This is the gram negative, curved rhodureus positive, darting motility, CLO turns pink, catch A carcinoma, and regression of malt lymphoma with eradication therapy, and duodenal ulcer strongly linked to the infection. So this is all about H. pylori. Thank you.